رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. بسم الله الرحمن الرحيم. Assalamu alaikum everyone. Hi. Very quickly, I'm going to discuss a few things in terms of approaching medical school. I mean, this could be potentially useful, God willing, in terms of people who are maybe, I don't know, in their A levels or just studying in general. But regardless, I'll just try to maybe speed through this a tiny bit. There's a few things I'm going to cover mainly. One of them is going to be how to approach the different aspects of medical school in terms of lectures to anatomy to learning medications to conditions and so forth. Just a bit of a note, this is aimed at maybe more so first year medical students. I'm a second year medical student, so I'm just kind of speaking from a bit of experience. I'm just letting you guys know maybe some mistakes which I made, or like some common mistakes which I think is very easy to fall into as well. So let's get started. Firstly, in terms of, let's say, for example, how do you even revise? That's a very big question. It's now, I can't remember the date, it's almost the middle of January. So it's just something to think about. You've had probably around 3 months now to get settled into medical school and maybe start thinking about how do I revise best. I remember first week of medical school, I think I tried like every single method there was over the first week to the first 3 months of medical school. And I would say that from my personal experience, Anki, I found eventually during, I think it was about a month or 2 months in, I realized that that was potentially, like I said, for me personally, the best in input to outcome yield. So how much effort I put in to how much outcome I get out. I found that it was the most beneficial. Now, in terms of revision methods, a very big note I would say is you don't have to pick one. It could be that for anatomy, you find a specific method beneficial. However, for lectures in general, you find something else. And then when you're learning maybe medications and so forth, it's a different method. Now, coming into the new year, um, and like beyond January and so forth, it's important to start thinking about how am I going to approach the different things. Sometimes, and you probably saw this in maybe your A levels, you can't take the same approach to everything. It may be that you have to take a slightly different or an altered approach, maybe to learning medications as to how you would approach anatomy. For example, with anatomy, it's a very much physical or like it's very visual. So you may really like, for example, with Anki, you may like the image occlusions, you may like just the basic flashcards or potentially drawing out some structures. However, it could be that in terms of maybe a biochemistry lecture, it may not cross over as much. It may be that with biochemistry, you want to learn a few more, or like a bit more of the specific intermediates, enzymes, and so forth. So it could be a slightly different approach. Now, like I said, so let's start with anatomy then. So image occlusion, you may like. There's also apps out there like Complete Anatomy. Me personally, I found it very beneficial because it helps you to visualize the anatomy much more, whether that's anatomy in terms of the origins and insertions of muscles or just maybe the general bone anatomy and so forth. So that's something 100% to consider, especially in terms of what I personally say to my A-level students is to try to learn your knowledge in 3D. And I would also say that this is very applicable to medical school and in general further studies as well, and in all aspects of life. Because if you learn your knowledge just for the basis of, let's say, for example, I looked at the textbook and I say, okay, great, I've listened to X, Y, Z, but how do I actually apply this? Because it's one thing to read the sentence, and then after that, you actually have to apply this as well. So that's what I would say is very important. And the way you can do this, for me personally, I would say with anatomy, it's quite easy compared to other aspects. Maybe just go on Google, search some images of dissections or other aspects, maybe, and just Google or just a general anatomy and try to get a bit more of an understanding, orientate yourself with the anatomy and so forth. So that's how I would potentially approach anatomy. You guys have probably come across anatomy, however, so far. Now, I think the main few things you're probably going to come across much more is the medications, so the different types of drugs. Now, it depends on this approach your medical school takes. So, for example, if your medical school is maybe they're going to have a lot of teaching in potentially cardiology. That's probably you probably will at some point during this year. You're going to come across a lot of a variety of different medications. For example, you've got beta blockers, you've got calcium channel blockers, CCBs, for example. You've got ACE inhibitors, angiotensin receptor blockers. There's a variety of different ones. So the question arises, how do I approach this best? Or what is my way to approach this? Now, with medication specifically, I would say personally, I found that just physically with your hand, pen and paper, very simple. If you have an iPad and want to be a bit fancy, that's great. But me personally, I have an iPad, all praise to God, but like I just I find pen and paper the easiest one, very quick, very scribbly, just so I can kind of visualize it. So for example, let's say you have um, let's say you're in at this point you are learning four specific medications, okay? What I would do personally is I'll just kind of just draw over my thing over here. I probably should have put a new one in, but it's fine. I'll just draw over it. Okay, cool. So, and if my camera just glitches or something, ignore that. I don't know why I'm having some issues with my camera or my webcam. So let's say, for example, I've got four drugs I need to learn, okay? I don't know what the condition is or whatever the common topic is. There's just four drugs at this point I need to learn. What I would do is I would just draw a little thing in the middle, a little circle, and I would draw four different arrows. And this is on like a piece of paper. It doesn't have to be neat. Main thing is just so you're taking your knowledge and rather than just I don't know, rather than just trying to go straight into your memory, you're giving your learning another aspect, okay? Meaning, let's say for example, now I'm going to write about, I don't know, here we're going to discuss some type of beta blocker. Then we're going to discuss here a ACE inhibitor. Let's say, for example, we're doing some cardiology related thing. So an ACE inhibitor, apologies, I don't have my mouse, so it's a bit scruffy, the handwriting is. So beta blockers, ACE inhibitors, ARBs, and let's say a calcium channel blocker, okay? For example. Now, what I'm going to do is maybe I'll discuss very quickly the specific under the current guidelines, what specific conditions is it for? Is it for hypertension, like high blood pressure and so forth, or is it for any other specific things? So very quickly, me personally, I like making it as simple as possible. I would just make a very quick note. I would just write four, very simple. You might like indicated four or something like that, but just four, very simply. I just write it out. Then what I would do is you write the mechanism of action. Okay, mechanism of action. You'll probably discuss this a bit more in your school with like your unis about this. Then I'd probably discuss any adverse side effects or adverse, I think it's called drug reactions, ADRs, and then any CIs. CIs meaning contraindication. You can look into this a bit more when you like learn this, I think, with your medical schools. So that's how I'd go about the structure and approach for this. Now, in terms of this is the first step. So let's say I've come across a resource, whether it's a lecture slide, some form of resource that my professor or my lecturer has given me or has published on like whatever platform you use. Then what I'm going to do is I'm come across it. Great. I'm just going to draw it out just so I can structure it in a way which I find beneficial. Okay. Now I like to try and get some consistency in my revision method. So for me personally, now this is the way I go about any form of medication I need to go about or like learn. Now, in some certain, I don't know, conditions or some certain parts of the year, you may have to learn a variety of different ones. So, for example, with the I don't know heart-related ones, you may have to learn more about like diuretics and I don't know thiazides and so forth. Now you can have a lot more. What I would just do is I would just add a few more arrows. Once again, I personally just like to have that visual aspect because I don't think, like I said, me personally, I don't think it helped me in year one just go straight into Anki. It just didn't work for me as much. 'Cause I'm like quite a visual person. I like posters and like writing things down. However, I will also say this, which is you also need to have a limit because you can't just write everything down. Let's say, for example, you've got five lectures to catch up with. You're not able to just make loads and loads of notes on each lecture. Let's say, for example, you want to do Ankis, I mean. If your revision method is notes, just be a bit cautious. Try to add some form of active revision in there, whether it's blurting, making some physical flashcards or whatever it is. But if you're doing Anki, like I said, I would recommend drawing it out so you add that next layer to your understanding and your memorization. Now, what I would do, this is something which I personally like. Like I said, I like having the consistency. So let me just bring it onto the screen. I think you guys should be able to see it. Um, it's just like I'm like another user, so I think I'm just okay, I don't know what's happening there, but that's fine. Okay, let's say for example, actually that's not gonna work. Let me just make a deck. Another thing with Ankis, I would really recommend try to be as organized as possible. Let's say, for example, I'm just going to say, I don't know, what can I think of? Week one, okay? I personally wouldn't split it into weeks, but let's say I'm just gonna say week one. Now in week one, I'm gonna say lecture, no, lecture X, and I personally just like to write the date as well. What's the date? So it's the 12th of the 01 of the 2026. Okay. Now just put that underneath there. And that's useful because now let's say, for example, we're in week two or like, I don't know, whatever your university is doing, for week two and it's separate. Okay. So if I want to go into my week one lectures, press that, opens it up and great. Okay. Now let's say, for example, this lecture is about pharmacology. Okay. And medications, drugs, and so forth. Okay. Now you can see I've already got the setup on here because it's my personal favorite one. Now, like I said, I like having consistency. So basic, I don't think works for everything. I think you have to switch around a lot. For me personally, I think close is amazing. So let's say, for example, we have a specific one. I can't think of something off the top of my head. Um, let's say we have a we have drug X, okay? Now drug X is for a specific condition. I'll try here the condition. Condition. The mechanism of action is it's a I can't even think on the spot. Mechanism of action is something, okay? Great. Then the ADRs is headache, fatigue, gastrointestinal disturbances, okay? For example. And contraindications are you can't, um, or let's just say contraindications is maybe, I don't know, pregnancy. Great. Okay. Now, for drug X, I have all the information on one Anki or like one tab essentially. So what I do, this will differ depending on if you're on MacBook or if you're on laptop, normal laptop. I've got like an Asus laptop, so it's a non-MacBook. It's Control Shift C. So Control Shift C. Then let's say for mechanism of action, I'll just write water bottle, okay? Great. Water bottle inhibitor with a cat. Okay, great. I'm just looking at my desk and random stuff. Okay, Control Shift C. Can you see here? This is C1, C2, meaning this is now a separate flashcard. This is now a separate flashcard, okay? The same thing, I'll follow the pattern. Control Shift C, Control Shift C, okay? If it's on MacBook, I don't have a MacBook, but I think it's Command. It's like whatever button, like on non-MacBook, we press Control C to copy. Whatever you use on MacBook, just press that same button. I can visualize it, but I don't know what it's called. Okay, let's continue. So I've got my different information for drug X, for example. Great, it's there now. So what I'm going to do is I'm just going to press Add. Perfect. By the way, there's so many different shortcuts for Anki. Please try to learn them. It'll save you so much time. But okay, cool. So we have lecture X, date is today, and we've got 4 new cards. Let's press steady now. This is how it comes up, okay? So drug X, it's 4. I can't remember now. What I even write, I can't remember. Okay, I took a condition. Fine. I genuinely forgot that, so that's great. And I press, let's say I completely forgot that. I'll write again after 1 minute. Great. Mechanism of action. I don't know that. And if you're completely brand new to Anki, by the way, you can press like space bar or you can press enter. It's probably much faster than using your mouse. And then let's say, for example, you've got 1, 2, 3, 4. You can press 1, 2, 3, 4. 1 is again, 2 is hard, 3 is good, and 4 is easy. In general, I tend to alternate between these two. I think this is too repetitive. And I think this is like realistically, if I found something this easy, I wouldn't have made an Anki on it if it was like that common knowledge, I guess. Um, but okay, that may be more so relevant closer to exam season, I guess, if you're just trying to get through as many Ankis as possible. But okay, cool. That is my personal method. That is close Ankis, okay? You press Control Shift C and you do this. Now with this, you can use some form of AI to make your Ankis, I guess, but just be careful, make sure that they actually, of course, make sure that you're putting in the information yourself. It may help in terms of formatting, but if you want to be a bit more on the safe side, you can also just do it yourself. It will also help. Now, something just came to my mind actually is there's a question which is, should I do pre-made Ankis or should I make my own Ankis? In year one, I use pre-made Ankis. Firstly, I would say the question arises, how old are the pre-made deck? Secondly, can people vouch for it? Meaning, can they have people used it and Do they say the deck is good by itself? It covers all like the majority of the content, um, and so forth. So, and something to think about as well is, let's say, for example, I don't know if you've just gone from A level into medical school or you've taken a gap year, but let's just go back to your A levels or your GCSE. Imagine I said to you, I have this resource, it's 3 years old, my notes or my resource or my Anki's or something like that, and I'll give it to you. And if you want, you can rely entirely on this. It's most likely that you probably wouldn't, or you'd be quite cautious to, or you would add much more information to it. Now, in that situation, you can kind of think to yourself, is it really that beneficial if I have to add so much information? Or is it just easier if I go and make it myself? Because one, I know the formatting. Two, I can have the consistency in a method which I like. And that's what the main thing I would say. Now, of course, you just basically enter medical school. It's been about 3, 4 months. You may not know what Anki method works best for you. Have a go. Try a few different ones. If you're doing an image, use image occlusion. Like I said, for me personally, now everything I just use Cloze. I just find this the most consistent one for me to use. And I like how I can put the information on this, for example, because earlier I think I was doing a variety of different conditions like, I don't know, what was it, HIV, HSV, HPV, different types of viruses, EBV, CMV. And in this, I had to cover a variety of different things, a bit of information, if there was any category about it, symptoms, and so forth. And you can see that this structure is quite consistent. Now, then the question arises, what if I just want to add something very simple? What if I just want to ask a question? Okay, what is um, 1 plus 1? Okay, that's my question. Great. Now I want to put the answer. Now, do I go back to basic or can I just keep that consistency? Me personally, I just keep the consistency. Control Shift C, uh, 2. Great. And then I press Control Enter and it automatically adds. So I'll press Control Enter and it's added. Okay. Now if I press Close, now, let's say I go through all the different ones. 1 plus 1. Can you see? There's a consistency in it. Rather than you having to switch back to basic, then to Cloze, then to image occlusion. Like I said, this is what I found personally works best for me because I like having the consistency in my studying method. And one final thing as well, I probably would conclude with is every lecturer teaches differently. Every subject is slightly different, whether that's biochemistry, anatomy, and so forth. What's the saying? It's like not one shoe fits all or something like that. I would say that you need to try to alternate your study method slightly for each thing. Don't try and take the exact same study method. Just let's say, for example, Anki's works amazing for the pharmacology. That doesn't mean it's going to work amazing for the physiology. A lot of physiology you may have to actually understand. And to understand, it may be good just get a scrap piece of pen and paper, scribble and write whatever you think, or like write the information down. Try your best to understand it, okay? In terms of the, I think what else I was going to discuss? I think I would say we have covered Anki's and I guess a bit more about their consistency. Um, Time management. I think I'll probably stop the video there. And if anything comes to my mind, I probably make a video at a later date, inshallah. But I hope this has been useful, God willing, and I'll probably upload this in a bit. Assalamu alaikum wa rahmatullahi wa barakatuhu.